My name is Kayla. I'm going to perform administration of intradermal injection skills video today. So I'm going to verify the healthcare provider's order. I'm going to gather my supplies. I have gloves, alcohol swabs, gauze, a bandage if needed, the 29 or 30 gauge 1/2 inch needle with the 1 milliliter syringe. In this case, we already have the needle permanently attached to the syringe. My medication vial. I'm going to verify my 6 rights of medication administration, which include right patient, right route, right time, right drug, right dose, and right documentation. I'm going to check the medication order in the EHR. I'm going to make any calculations. In this case, we are administering 5 tuberculin units per 0.1 milliliters of this medication. I'm going to go ahead and enter the patient's room. I'm going to introduce myself. Hi, my name is Kayla. I'm going to be your nurse today. I'm going to provide privacy, close any doors and curtains. I'm going to ask them to confirm their name and date of birth, check their wristband. I'm going to let them know I'm going to be administering a tuberculin skin test injection. It's 5 tuberculin units per 0.1 milliliters of the medication. Its purpose is to aid in the detection of tuberculosis infection. Some common side effects include itching and redness at the site. You might feel some stinging and burning sensation as I inject the medication. Induration at the site is expected if you have a positive reading. Some adverse effects include bleeding and rash at the site of injection within 12 hours of administration. If you experience any of these adverse effects, please report them to me immediately. Do you have any questions? Okay, so I'm going to perform hand hygiene and apply my gloves. If it's a new vial, I would remove the cap. I'm going to take my alcohol swab, I'm going to take it out and clean the top of the cap. I'm going to take my syringe and needle with the cap still on. I'm going to pull back to get air to my correct dose of 0.1. Now I'm going to remove the cap and insert it into the vial. And I want to put the air back in. I'm going to turn it upside down and let it go to the 0.1. I can speed up the process a little bit. Let it go to 0.1. And I would tap on the needle to get any air bubbles out. I would insert all the medication back in if needed, if there was still air bubbles. I'm going to push gently back the air into the medication. Okay. Next, I'm going to use the one-hand method to recap that. And I do want to show you guys it is 0.1. Zero point one. 0.1. Okay. Next, I would find the appropriate site. I'm going to use one hand width from their wrist, and if it's contraindicated, I would use a different site. At this point, I don't see any lesions or discoloration. I'm going to tap for tenderness. We're okay. We're going to use an alcohol swab. I'm going to take the alcohol swab out. I'm going to start from the center and clean outward about 2 inches. I'm going to take my syringe and I want to hold the skin taut, pull gently back with using my index finger and thumb, and I'm going to insert at a 5 to 15 degree angle with the needle bevel up. And before I insert, I want to comment that I would want to feel some resistance. If I don't feel any resistance, I would start over. The needle might be too deep. I also want to notice a mosquito resembling a mosquito bite, anywhere from 6 to 10 millimeters. So now I'm going to inject. And I'm going to inject the medication slowly. As I'm doing that, I'm going to get gauze and gently remove the needle. And I wouldn't place the cap. I would put this in a sharps container as well as the cap. And I would get another alcohol swab, clean, starting from the center, working outward about 2 inches, and use a Band-Aid if needed. Make sure they're not, an adhesive Band-Aid isn't going to irritate their skin. I would, the vial, make sure that it has my initials and date. Next, I would remove my gloves, place them in the trash, and document what I did.